So what is contracted pelvis? So this basically comes in obstetrics. So first of all, you should understand the normal anatomy of the pelvis. We will go into the normal anatomy of female pelvis later and the types of female pelvises. So but now first let's talk about what is contracted pelvis. Obstetrically, it is defined as the pelvis which is small enough so that the normal mechanism of labor does not take place obstetrically. But anatomically, if any of the essential plane, at least one, is shortened by 0.5 centimeter or more, that is considered to be a contracted pelvis. So contracted pelvis can be at the inlet, mid pelvis or outlet. If at the inlet obstetric conjugated less than 10 centimeter or greatest transverse diameter is less than 12 centimeter or diagonal conjugated is less than 11 centimeter. So 10, 11, 12. If it is less than that, or in the mid pelvis, if the sum of interstitial spinous and posterior sagittal diameter of the mid pelvis is 13 centimeter or below, or if the outlet has interstitial tuberosity, the distance between ischial tuberosities is less than 8 centimeter, then it is considered to be outlet contraction. So what are the causes? Causes can be congenital or acquired. So in congenital, there is something called Naegele's pelvis, Robert's pelvis, okay, Naegele's pelvis, Robert's pelvis, rachitic pelvis, high or low assimilation pelvis. Acquired, that I told, congenital causes of rickets was there. Now acquired causes of rickets like vitamin D deficiency, also rickets and stimulasic pelvis, trauma, pelvic fracture, dislocation of the lumbar vertebra, spondylolisthesis, degeneration like scoliosis, kyphosis, poliomyelitis, infection, TB, and neoplastic like bone tumors. So what is the presentation? Presentation can be the female on general assumption she can have short stature because short stature is related to the development of contracted pelvis, one of the risk factor. What is short stature? If the female is less than 4 feet 10 inches, that is called short stature. Is pelvic spine and hip deformities. If you see any pelvic hip or spine deformities, then more likely there is contracted pelvis. And if there is dystophia syndrome, which we will cover, if that is present, then that is considered to be having a risk for contracted pelvis. So how you will find out that the female has contracted pelvis? So during delivery or during late pregnancy, if there is presence of non-engagement, if the abdomen is pendulous in primary gravida, if there is malpresentation, so malpresentation, one of the risk factors is contracted pelvis because the baby's head cannot engage into the pelvic cavity. Fourth, one of the ways to find out is clinical pelvimetry, which we will cover, very important topic. So diagnostically, imaging findings can be helpful. X-ray no longer recommended. CT scan is the best. MRI is the best. So USC can be done to measure for the fetal head dimension, so that whether there is will be cephalopelvic disproportion or not, that can be found out. So what is the complication? That I already told, the baby is not having any engagement, non-engagement, presentation, pendulous abdomen, cephalopelvic disproportion. So that can lead to being non-engagement. That can lead to cord prolapse during delivery after the rupture of membrane. There can be premature rupture of membrane, prolonged rupture of membrane because there is no engagement here. Prolonged labor, obstructed labor can be there because of cephalopelvic disproportion and increased risk of obstetric operative interference. And also there can be birth canal injuries like cervical laceration, vaginal laceration, and perineal tear can be there. So increased risk of birth canal injuries. Basically, the baby is too big for the pelvis, so there can be non-engagement, malpresentation, all the way go down, 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 and injury coming down. So rupture of membrane, cord prolapse, and which can also lead to perinatal asphyxia. So even the baby can be injured. So what is the management? The best management is cesarean delivery. After diagnosing the contracted pelvis by clinical perimetry, the best method is to avoid the baby to pass through there. So best method is to do bypass of the birth through vagina, that is CS.